My name is Julie Vigil, and this is my poster presentation on Zika virus. What is Zika? The Zika virus is typically the result of a bite from an infected mosquito from the Aedes species. This is the same type of mosquito that can spread dengue and chikungunya. Notwithstanding, this is not the only form of transmission for this virus. Zika can also be transmitted via sex, a blood transfusion, or from a pregnant woman to her fetus. Similar to dengue and chikungunya, Zika is spread when a mosquito bites a person already infected with Zika, and then that same mosquito bites another person. The mosquito must bite the infected person within the first week of infection when the virus can be found in a person's bloodstream. However, a significant difference in transmission from other mosquito-borne illnesses is the ability of Zika to be transmitted by other methods, other than mosquitoes. Figure 1 illustrates the various methods of transmission. A study published in Pathogens explored the presence of Zika RNA being detected in semen, urine, vaginal fluid, and cervical mucus. To quote this report, the infected patients who transmitted Zika to their sexual partners were symptomatic. However, cases of asymptomatic male to female sexual transmission via vaginal and oral intercourses have also been reported. Unquote. This type of transmission also supports transmission from mother to baby during pregnancy and via blood transfusion. Where is Zika? The Zika virus was first discovered in Uganda in 1947. Over the years, there had been outbreaks of the illness in Africa, Asia, Micronesia, and French Polynesia. Yet it was the first reports in May 2015 of infection in Brazil, with rapid spread occurring in early 2016, that caused the greatest alarm. During the outbreaks of Zika in 2016, testing for the Zika virus was recommended, particularly if you had traveled to a country with the current Zika outbreak. For pregnant women, the recommendation was to be tested for Zika if they were experiencing any symptoms or have traveled to an at-risk area. It should be noted that currently there are no countries, including the United States, reporting an outbreak of Zika. While there are no current cases of Zika reported in the U.S., Americans need to be aware of areas that have reported past outbreaks and take precautions. Those areas are the Pacific region, South and Central America, the Caribbean, Africa, and parts of South and Southeast Asia. The obvious precautions would be the use of insect repellent, wearing protective clothing, and the use of mosquito nets while sleeping. However, as previously mentioned, Zika can be transmitted sexually. Based on this, it is also recommended that condoms be used if there is a risk of Zika transmission. A study published in the American Journal for Public Health reports that the highest risk of infection within the continental U.S. has been the southern states moving northward towards the Atlantic coast, with the highest concentration in Mississippi. Quoting the American Journal for Public Health, with 100% of the transmission risk assumed, one-third of the contiguous United States population is living in an area that is considered potentially high risk for Zika infection. Unquote. Figure 2 is a map from 2017 showing the range of the Aedes mosquito in the United States, highlighting the likelihood of encountering a diseased mosquito. The purpose of this 2017 study was to raise awareness for planning and prevention strategies in the areas identified as high risk. It also highlights that transmission is not strictly limited to geography. due to sexual transmission. Symptoms and complications of Zika. One of the most alarming methods of transmission is from mother to child during pregnancy. Figure 3 depicts how Zika is transmitted from mother to child. Current research has shown that Zika is the cause of microcephaly and other severe brain defects. These birth defects and disabilities are known as congenital Zika syndrome. There are 5 features that are unique to congenital Zika syndrome: severe microcephaly, in which the skull has partially collapsed; decreased brain tissue with a specific pattern of brain damage; damage to the back of the eye; congenital contractures such as clubfoot; and hypertonia restricting body movement soon after. The most commonly seen defect in infants has been microcephaly. Figure 4 shows the difference between a normal skull circumference on the right and the effects of microcephaly on the left. A Genes Development publication provides a description of microcephaly. Microcephaly is a neurodevelopmental disorder which is characterized by a marked reduction in brain size and intellectual disability caused by impaired cell proliferation and the death of cortical progenitor cells and the neuronal progeny. While microcephaly is not a fatal condition, it can be the cause of life-threatening abnormalities, making the prevention of this condition a top priority. Once again, from the publication in Genes and Development, the increase of microcephaly cases and the coincidental Zika outbreak led the World Health Organization to declare a public health emergency of international concern in early 2016. For most people, they do not exhibit any symptoms when infected with Zika, which aids in its ability to transmit so easily. Figure 5 depicts the various symptoms of Zika, which include fever, rash, headache, joint pain, conjunctivitis, and muscle pain. These mild symptoms can last a week to several days and usually do not result in hospitalization or death. As previously mentioned, this lends to an easier transmission rate. Additionally, these mild symptoms lend themselves to simple treatments such as rest, fluids, and acetaminophen for fever and pain. Fortunately, the fatality rate for Zika is incredibly low, with only 2 deaths reported in the United States that have been related to the Zika outbreak of 2016. While that seems promising, there are some who have experienced other complications, such as Guillain-Barré syndrome. Guillain-Barré syndrome is described as when your body's immune system attacks its nerves, resulting in muscle weakness and, in rare cases, full body paralysis. Fortunately, most patients do end up making a full recovery from this syndrome. Prevention methods. With the mild symptoms that have been previously reported, it is hard for communities to assess the potential for an outbreak of Zika. Unfortunately, until a community begins to see complications related to Zika, specifically microcephaly or Guillain-Barré disease, they do not enlist routine testing. Once either of these conditions appear, a community should begin testing and employ surveillance to help limit the spread of the virus. Education should also be provided regarding the dangers of sexual transmission and the complications associated with pregnancy, so that individuals are prepared to fully protect themselves. An exception related to routine testing should apply to pregnant women, since this group tends to suffer the greatest complications from Zika. The recommendation should be to test a pregnant woman if it is known they have visited an area known for Zika. For women who are planning to become pregnant, the Centers for Disease Control and Prevention makes the following recommendation. Couples trying to become pregnant should work with their healthcare providers to carefully consider the risks and possible consequences of travel to areas with a Zika outbreak or other areas with a risk of Zika. In addition to the previously mentioned prevention methods, the aforementioned report in Pathogens lists several interventions to help control the mosquito population in areas that have the potential to develop Zika. Such measures include inhibition of mosquitoes' reproduction through reduction of their breeding sites and eradication of the larvae and adults using chemical insecticides with larvicidal and adulticidal action, insect growth regulators, chitin synthesis inhibitors, release of sterile male mosquitoes, and use of bacterial biolarvicides. In 2017, the New Mexico Department of Public Health issued an awareness campaign to help prevent the spread of Zika. The focus of this campaign was to not only educate the citizens of New Mexico on how Zika is transmitted, but it also provided information to pregnant women and their partners who may be considering travel to areas where Zika virus transmission is ongoing. The Department of Public Health ran this campaign in English and Spanish using television, radio, billboards, and movie theater advertising. This targeted approach possibly helped prevent further infection and serious Zika-related complications. To conclude, the American Journal of Public Health sums it up best in this quote: "Healthcare systems need to be prepared for testing, treatment, and management of cases that may develop more complicated health outcomes, including microcephaly and Guillain-Barré syndrome." Unquote. Unlike other mosquito-borne illnesses, Zika is not solely transmitted through a mosquito bite. Given its ability to transmit sexually and from mother to fetus, this virus can be especially challenging for health professionals, particularly in areas with limited resources. Thank you.